Hello, my name is Fintan. I work in healthcare and I believe in letting nature take care of us, especially when it comes to our health. In this short video, I'm going to talk about serrapeptase and how it can help with hip bursitis pain. Does hip bursitis ever go away? That's a question that many people with hip bursitis ask. Or another common question for people with hip pain is, how do I get relief from my hip bursitis pain? So in this video, we will discover what is hip bursitis, what causes hip bursitis pain, and what is the best hip bursitis treatment. But first, let's take a look at the anatomy of the hip, the function of the hip bone, and why the hip area can become inflamed and painful. The hip bone is divided into three parts: the ilium, the pubis, and the ischium. Before puberty, these individual bones are separated by the thyroid cartilage. Between the ages of 15 to 17, the three bones begin to fuse together, forming a socket that is shaped like a cup and is called the acetabulum. This process completes itself between age 20 and 25, when the head of the femur bone integrates with the acetabulum in the formation of the hip joint. The hip joint could be described as a ball and socket joint. A healthy hip is made up of the femur, the femoral head, the acetabulum, tendons, ligaments, as well as cartilage. The bones are kept in place by the ligaments. The muscles surrounding the hip joint are flexible. They shorten and lengthen, causing the hip joint to move. The surface of the femoral head joint are encased in cartilage. The main function of cartilage is to cushion the bones and make it easy for them to slide against each other. Surrounding the hip joint is a capsule. The space between the capsule and the joint cavity contains synovial fluid. The fluid is made by the synovium membrane and is necessary to provide nutrients to the joints and the cartilage. So when you have a healthy hip, the membrane provides enough fluid to lubricate and completely get rid of any friction in the hip joint. In the ideal world, when all the pieces of the hip work together in unison, allowing the hip joint to function normally, we don't have any hip problems. But what causes hip pain? Well, there are a number of reasons. These are the top 5. Bursitis, arthritis, septic arthritis, osteoarthritis, dehydration, avascular necrosis. The symptoms of hip pain will vary depending on what causes the pain, and these causes include hip pain, hip and leg pain, limping, groin pain, joint pain, a warm feeling in the hip area, a loss of mobility, swelling over the hip area, trouble sleeping on the affected hip, and tenderness in the hip. The symptoms will differ in intensity, going from mild to severe pain. Hip pain can be the cause of a disability. If you are suffering from any of the above symptoms, it's important to visit your doctor for a diagnosis. A healthcare professional will ask you about any hip problems in the family, your lifestyle, and your job to determine what was the cause of your hip pain. In addition, they will conduct a physical examination as well as maneuvering and rotating the hip. This will indicate the pain exacerbating positions. Inflamed areas will be determined by pressing hard on the affected area. Raising the leg into a straight position will detect any signs of sciatica. If your doctor can't determine what exactly is the issue, you may be sent for an X-ray, a CT scan, or MRI to get a more definite cause of the hip pain. So what's the best treatment for hip bursitis? Well, number 1 is rest. Number 2 are hip exercises such as walking, tennis, running, hiking, biking, or swimming. Number 3, strengthening exercises such as free weights, exercise ball, weight machines, and resistance bands. Number 4, prescription painkillers, or in extreme cases, you may need a hip replacement. But for people who have tried all the methods above and are still asking the question, does hip bursitis ever go away? May I recommend serrapeptase, a natural enzyme. Why? Because it worked for me. I had severe hip bursitis pain for more than a year. I took serrapeptase, a natural enzyme. I found that after 3 months, the pain in my hip was so much better and I was able to function normally. But what is serrapeptase? It's a natural, powerful enzyme that reduces inflammation and gets rid of hip pain permanently. Serrapeptase has been used for over 30 years to help with inflammation and pain. It's a natural enzyme and works to get rid of any excess swelling and reducing pain. If you have had hip bursitis diagnosed and you've tried different treatments to get rid of the hip pain, and like me, you're not getting the results that you desire, Trust me, try serrapeptase. It does work for most types of hip pain, bursitis and swelling. For more information, please visit my website. Thank you.